Greetings, OSEP leaders and project directors. I'm Mark Weist. I'm a professor at the University of South Carolina. You can see the title of my talk today. I have no conflicts of interest. This is what I'll cover. I'll talk about school mental health in the United States. I'll present on our interconnected systems framework for school mental health and positive behavioral interventions and supports, which we've been working on for about 15 years. We'll discuss the impact of the pandemic on students, talk about other factors in the 2022 context, and discuss some directions for moving forward with thanks to my colleague, Kathy Short from School Mental Health Ontario. I got involved in school mental health back in the early 90s. I'm a clinical psychologist, but my initial position was working in the schools in Baltimore. We're developing school health centers, and as we opened them, we realized the number one need for students was related to unmet mental health issues. That led to the development of this expanded school mental health model that really grew in Baltimore and in other cities around the country, other areas around the country back in the early 90s. You can see this notion of a shared agenda, family, school, mental health system partnership, interacting with other community collaborators, and the community professionals augmenting the work of school employed staff. We were fortunate in 1995 to receive funding for a national center on school mental health from the Maternal and Child Health Bureau. 2 centers were funded back then at University of Maryland, where I was, and University of California, Los Angeles, also 5 states to build infrastructure for school mental health. You can see South Carolina is one of those states, and that's where I am now. And the National Center for School Mental Health is in its 26th year of funding and doing very well, and you can see the website. Some of the early data documenting the importance of school mental health. This is a study by Catron, Harris, and Weist in Tennessee, documenting that when more comprehensive school mental health services were offered to students in schools, you can see 96% received them. But when students were referred out for services in clinics, only 13% actually received care. This is another study a little bit later by Mark Atkins and colleagues in Chicago. A little bit different initial enrollment rate, but then look at the retention rate at 3-month follow-up. All of those students seen in a comprehensive school mental health program were still being seen, and 0% were being seen in clinics. And that's something that we see. We see a precipitous drop off of care when students are referred out to specialty clinics. Over the past 25 years or so, there's been a growing literature documenting the many benefits of school mental health, including significantly improved access, improved early identification intervention, reducing and removing barriers to learning, and achieving valued social, emotional, behavioral, and academic outcomes. Just one of the studies that I found is shared. The caveat is when done well, and we want to avoid a co-located strategy where you have clinicians come in, let's say, to a building Tuesday, Friday, but nobody knows what they're doing. Beginning in the early 2000s, the National Center for PBIS and the National Center for School Mental Health began to work together systematically. Prior to that, it seemed like PBIS and school mental health were operating sort of separately. Through that work and with the leadership of Susan Barrett, who will talk to you later, and Lucille Eber, we developed an ebook on an interconnected system framework for school mental health and PBIS. And this covers core aspects of the ISF, clinicians coming into schools, being on teams, well-done teams, using data, choosing evidence-based practices, implementing them, refining them, aligning programs, a vantage point from a building, a district, a state. This came out in 2013 and is a widely downloaded document. And there's been an updated version of the ISF ebook that came out in 2019. And in this panel, Susan Barrett will talk to you more about the ISF. A key component of the ISF is doing better with data management and screening. This is a study as part of a larger randomized trial. Joni Splett led this study where schools will typically do screening based on observation. A student is late, a student has attendance problems, a student is getting into discipline issues, a student is failing, that will lead to perhaps referral for more intensive services, for example, tier 2 early intervention or tier 3 treatment services within the multi-tiered system of support. When you add a systematic screener, you'll add about 18%, or you go from 10 to about 28% of students presenting significant needs. And in that additional 18%, about half of the students presented really significant needs, especially in the areas of depression, anxiety, trauma, internalizing issues that are more likely to operate under the radar. So as we ramp up screening, and we believe rates of problems now post-pandemic are higher, and I'll touch on that later. Imagine a fluid continuum of student need. So in screeners, and the one that we use for the study, you can pull out subscales: anxiety, depression, attention problems, conduct aggression, adaptive behavior. You can see at the top, they have all of those issues: internalizing, externalizing, low adaptive behavior. They have chronic problems. The top 3% or so of students in schools often have multi-system involvement. And then down to the bottom, you have, let's say, a student with anxiety, but positive adaptive behavior and doing pretty well. Students will move up and down on that continuum. So a big issue is, how do we fluidly match evidence-based practices to that fluid movement of students along that continuum? This is a large randomized trial we had funded by the National Institute of Justice, 12 schools near Charleston, South Carolina, 12 near Gainesville, Florida. 1/3 were assigned to PBIS only, 1/3 we dropped clinicians in the building, and typically you'll see just parallel play, and 1/3 actually implemented the interconnected systems framework. And you can see some very encouraging findings in the ISF schools. We had more involvement of school leaders and clinicians on the MTSS teams. We actually had improved tier 1 programming. We had more students proactively referred for and receiving tier 2 and tier 3 supports. We had reduced in-school suspension and office discipline referrals, and we actually saw reduced out-of-school suspension and ODRs for students of color, so addressing some equity concerns. I've been fortunate to be in a lot of dialogue at multiple levels about the impact of the pandemic. This was a webinar organized by the Dutch International Mental Health Hub in March. And the webinar just documented the significant impact of the pandemic. You can see some of these quotes from adolescents: enormous impact, doing my best to not fall off a cliff, lack of trust in leaders. And you can see some other quotes there from staff working with those adolescents. And on the webinar, there was also discussion of evidence for increased social isolation, loneliness, depression, anxiety, eating disorders, suicidal ideation, and admissions for self-harm. The caveat is the empirical data still remain fairly limited, so some of these conclusions are preliminary. I've been fortunate to work with the state of Hawaii and was there recently, part of a webinar yesterday where the young people talked about the impact on them from the pandemic. These are some of the quotes from this leadership group called Malama Mental Health, feeling like folks aren't acknowledging how much the pandemic has impacted them, talking about virtual learning being dull, difficult, and often overwhelming. The impact of losing the boundaries between school and home, not having enough personal time, deteriorating mental health and health. Confidence has decreased, insecurities have increased. Students here, we are here for you from the adults, but that's not really acted on. You can check out this amazing group at that website. Some other observations: there's clear evidence that the benefits of in-person versus virtual school are significant. There's a report by UNESCO that I put up there. There's wide variability in school status and inequities based on zip code, district, i.e. whether schools are completely closed or open or hybrid. We're seeing a lot of arbitrary and biased decision-making. In Hawaii, we talked about who decides which students are welcome back. Many students are missing, disappearing, reappearing, disappearing again. Many students and families are frustrated and just walking away from virtual learning. We know the students who fail in virtual learning are highly vulnerable. And so we have these significant outreach needs for those that have been missing, those that have not done well. How are we going to manage this outreach? There have been positives. There's reduced shame about mental health, increased transparency, increased urgency to address mental health issues, increased support for school mental health. We're breaking down barriers, we're breaking down silos, we're doing more across disciplines and across systems, and we're seeing some real breakthroughs in virtual learning and in telemental health. So I've been fortunate again to be involved in discussions at multiple levels, and here are some of the major themes. The first is the absolute critical importance of the multi-tiered system of support as the anchor for all effective programming and the need for us to strengthen its core features. Brandy Simonson will talk after me, and Brandy will talk more about the critical role of the MTSS. Without a strong MTSS, programming will be disconnected, not impactful, and will not sustain. We know there's a lot of money flowing into schools now. We need to be careful that schools don't just check a box and purchase a program that doesn't get implemented. We need emphasis on mental health literacy, wellness, and resilience all together, and for students, families, and staff. We've been working with the mental health literacy program for a few years now and integrated into a study. Canada really does better with us on this than us on this topic. Mental health literacy, we know, is therapeutic. If you have symptoms and you learn about them, it helps you to feel better. We know that mental health literacy decreases stigma, which is probably the #1 barrier for people seeking mental health care, and it increases help seeking. And you can see these resources on teenmentalhealth.org. And then this is a newer product in the public domain developed by the Mental Health Technology Transfer Center and the National Center for School Mental Health. We know wellness is really critical for everyone. So here are some of the strategies: stress reduction, social support. And if you put those together where you reframe stress as something I can handle and then go talk to someone, get social support, it actually benefits your immune system. You can see some of these others: decreasing cell phones, social media, getting enough sleep, being mindful, being involved in nature. Walking the dogs has been one of my COVID coping strategies. And you can see some of the other ones here. That same impressive group, Malama Mental Health, also came up with some of their own recommendations for self-care. And you can see some really cool ideas by them: laugh more, go for a walk, correct your posture, practice forgiveness. School Mental Health Ontario is an amazing resource. Resilience is a key component of this. As they approach the new school year, they're framing the recovery and support to students and schools in relation to resilience. And you can see some key points here that resilience is really about helping students to draw on internal and external protective influences in times of adversity. We know that we have significant workforce needs. We've been fortunate to receive a recent foundation grant from the Blue Cross Blue Shield Foundation of South Carolina to expand the school mental health workforce, including 3 groups: school employed mental health clinicians, clinicians from community agencies, and what we're calling MTSS specialists, the humans to work at Tier 1 around climate enhancement prevention, at Tier 2 around mentoring, early intervention, classroom support, and at Tier 3 around family outreach, case management, and also outreach for all those students who've gone missing. Another theme is we need balance in the social, emotional, behavioral, academic framework. There will be a press to focus on the academic slide, which we know is very, very significant, but we need balance. And actually where students, families, staff is more on the social, emotional, behavioral side, and that's probably going to be true for a few years. There's a literature on evidence for what works during adversity. I'm not going to get into this. This is again from School Mental Health Ontario, thanks to Kathy Short and colleagues. But we need to be building our strategies on the literature on what works during times of high stress, such as what we've been through. And you can see the action plan, School Mental Health Ontario: amplify promotive and protective influences of schools, identify and address emerging and escalating student mental health problems, provide focused support for those disproportionately impacted by COVID-19. We know who those groups are. Emphasize the safety nets and social relationships, and build strong communication. And in that vein, we have to be careful to not spend too much time admiring the problem. There is a lot that we've been through and a lot of problems, but we also need to remain upbeat and positive, and we can handle this. We will get through this. This is a really nice theory of action for supporting student mental health as we enter the new school year from School Mental Health Ontario. I don't have time to get into it, but it's really, really well done. And Kathy Short was gracious enough to share it with us. Thank you very much for your time. I'm sorry I'm not available for the Q&A portion, but you're in good hands with Randy and Susan. Best wishes.